All right, guys, let's do a quick testing really quick. Can you hear me through the webinar? Testing, testing, 1, 2, 3.
Yes, we can.
If so, please type yes in the chat room. We're all good? Okay, perfect. Hello, everyone, and welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator. For over 2 decades, eLotus has been your trusted source for TCM continuing education for acupuncturists. We offer the largest selection of online CEU courses with over 3,000 CE hours. If you are new to eLotus, remember to sign up today for an eLotus account to receive a free 1 CEU course as a welcome gift. This offer is available to new accounts only. Have you visited eLotus lately? You may have noticed our new facelift. We offer various free TCM courses which are packed with valuable information that you can use in your practice. Our TCM Wisdom Tube is where we archive our weekday webinars, such as today's class. So if you did miss a webinar, you can visit here to watch the videos. We also have various demo clips and videos on our YouTube channel too. Plus, if you're a big fan of learning new acupuncture points that you can implement in your practice, we also have the ultimate free resource website full of Master Dong's acupuncture at our eLotus Core website. Here you'll be able to see needling demos, learn indications, locations, and much more. I'll provide all the links for you here in the chat room once I get to my computer. Before we get started, here's a quick introduction of Robert Hoffman. Robert is the Dean of Doctoral Programs at Yosan University, where he has also received his master's degree in traditional Chinese medicine. He received his DAOM from Five Branches University in San Jose and is currently a PhD candidate at Zhejiang Chinese Medicine University in Hangzhou, China. Rob travels to China several times a year for additional study and clinical rotations at the Zhejiang Chinese Medical University Hospital. His current research is in the use of mushrooms as adjunct therapy in cancer treatment and the role of mushrooms in T cell regulations. And that is why he is here, so he can give you guys a talk about that. Today's class is Chinese herbal medicine and its regulatory effects on tumor-related T cells with Dr. Robert Hoffman. And Rob, if you can do a quick testing on your end, I'll go ahead and hand the mic to you.
Does that sound okay? Yeah? No? Can you hear me? Okay. I see Donna questioning me, but you guys can hear me, right?
Oh, your Rob, Sam saying that your video is off?
Oh, my video's off? Let's see. Can you hear me now? Can you see me? How's that?
Okay, are we good? We're good.
I think
We're
so.
good now. Okay.
Thank you, Donna. Thank you, everyone at eLotus, for giving me the opportunity to speak to you today. This is a huge topic, and we have an hour. So what I'm going to try to do is give you an overview of the Chinese herbs that are effective in modulating and regulating the immune system, specifically T cells. This has been about a 5-year research project. It started out with mushrooms and has ventured on to kind of the entire Chinese pharmacopoeia, so it's been a massive undertaking. The first part of the PhD program in China is, of course, to continue to write and publish, so I've begun that process. And really this hour is based on a paper that I had published about 2 months ago in the Frontiers in Pharmacology journal. Tina Chen was gracious enough to start sharing that on social media, and that started the conversation, and that's what brought me here. So as you are all aware, we have roughly a 2,000-year history of treating different diseases through herbs and different formulations, but cancer, the word cancer, ai zheng in Chinese, doesn't exist in the classics. What we have is symptoms, symptomology, and words describing masses and tumors. those ideas appear as early as the Shang Dynasty, so 3,300 years ago. They're followed up in the Liji, the Book of Rites. And these are not strictly medical texts back then. These are kind of societal textbooks that talk about, or societal writings that talk about everything from government to health to just how to live, family structures, things like that. So our first medical text that we begin to see this idea of cancer and a description in really clear terms is, of course, the Huangdi Neijing. Huangdi Neijing talks about, I think it's 6 different tumors, so like Shiliu is a chronic tumor, Jinliu, sinew tumors, and it goes on to describe the various formations. But it also, interestingly, I'll say a word, maybe an illegal word. The Huangdi Nei talks about cures, right? If you practice, if you have spiritual practice, if you practice acupuncture, herbalism, and nutrition, you can actually alleviate the symptoms and the actual tumors themselves. In China today, when I go, I work in hospitals and also in outpatient clinics, and Chinese medicine is very much in use along with conventional Western therapies, chemotherapy and radiotherapy. Patients will use Chinese medicine to alleviate the side effects of chemotherapy, such as thrombocytopenia, leukopenia, but they also may use it as a primary form of treatment to keep a cancer in check, to keep a tumor in check. Anecdotally, I've seen patients just using Chinese medicine, just using herbal therapy to keep stomach cancer in check. One of my mentors has a patient with stomach cancer. She's had it for over 20 years, and the tumor has not metastasized. It has not grown. It's fully contained. Another one of my mentors has been seeing a liver cancer patient for I think it's 6 to 10 years. So there are very positive effects of using Chinese herbs as the primary treatment protocol. But most people are going to use it in what's called fuzheng. So that's utilizing Chinese medicine to tonify our upright qi and remove the evil qi. Let's dig into the slides here. Let's see. So we have to mention Tu Youyou. She's a great inspiration. She should be for all of us. Interestingly, right, she's not a Chinese medicine practitioner, but she began to study malaria in 1969, actually at the behest of the North Vietnamese government. She published her findings in the book, A Collection of Single Practical Prescriptions for Anti-Malaria. But why I bring her up and why I think she's important is that she was looking at Qinghao, but it wasn't the expected results were not coming up, and they were doing, typical herbal extracts with hot water. So she went back to Gehong's text, A Handbook of Prescriptions for Emergency Treatments, and realized that the extraction method was, he was using a different extraction method, or described a different extraction method. His method was to take a handful of Qinghao and soak it in cold water. And then after the soak, wring out the herbs and drink that entire cold water decoction. Once she started going down that route, the effects of the medicine were more clear. So that tells us that we can actually take classical texts, classical preparations, classical formulas, and apply them to a modern scientific method and figure out exactly how those ancient formulas or ancient herbal extracts actually worked. So just a little bit of background. It's estimated that about 25% of all prescribed drugs are actually derived from plants. Morphine is probably one of the more popular and most known herbal extracts. So this was 200 years ago. And the important piece to Western medicine, of course, is that we're able to purify, right, that plant and administer it in precise dosages, right? It'd be really hard to give raw herb extracts in a hospital setting unless you can actually define exactly which compounds are being used and what those dosage levels need to be. It needs to be consistent. And we know that 60% of cancer therapeutics on the market or that are being tested are based on natural products. Some interesting ones that refer to Chinese medicine are PSK. This is polysaccharide K. This is derived from Coriol's versicolor. This is Yunjern. This is a I was going to say a mushroom. It was first extracted by the Japanese in the 60s, and then the Chinese followed up a bit later with PSP, isolated in the 80s. Taxol from the Pacific yew tree. So that's Pacific yew tree. Oh gosh. Hong Daoshan, sorry, should have written English for you. And then, of course, the Chinese happy tree, Shishu, used to prepare more chemotherapy medications, and then a statin from the South African bush willow. So it's not just Chinese medicine herbs, right? And then, of course, we have a lot more things like antibiotics, digoxin from foxglove, salicylic acid from willow bark. These are probably all very clear to you and things you've seen before. So what do we look at when we want to figure out the mechanism? Because that's what's important in integrative medicine and in the biosciences, right? Mostly, we're looking a lot at secondary metabolites. These are all the aromatic substances. These are phenols, oxygen substituted derivatives, such as tannins. That's pretty much what we're looking at when we want to decide what the function is of an herb. There are also organic compounds that are produced by bacteria, fungi, plants. When you look at secondary metabolites, these are not the normal compounds needed for everyday life of the plant. These are things that are used to attack or to protect the plant, and they're kind of necessary for their survival. And interestingly, most of these compounds have antioxidant properties. Sorry. Some of those include flavonoids. These are phenol rings and heterocyclic rings, amino acid peptides, proteins, nucleotides, other bioactive constituents, and what has really drawn me into it are the polysaccharides and triterpenes, because that's what I find mostly in mushrooms, but also sterols, trace minerals, and glucans linked to these peptides or proteins. We're going to go over all of that in a second, if it's not ringing a bell from your Chinese medicine, biology, and chemistry classes. So sterols, these are steroid alcohols, right? They are found in all animals and fungi. These are organic molecules, right? The most probably notable one that you're familiar with would be cholesterol, and these are what make up all cell membranes. So phytoesterols, ergosterol, right? These are present in all fungi cell membranes. They're precursors to vitamin D, and they're also antifungal, antiprotozoal, anti-tumor, and antioxidant, which is a really good case for utilizing mushrooms or medicinal mushrooms in your practice. Triterpenes, we'll do a few slides on this actually because it's very interesting. So triterpenes or triterpenoids, these are metabolites that have anti-inflammatory, antiviral, antimicrobial, antitumoral, and immune modulators. And this is really important because we think of so many Chinese herbs as simply boosting the immune system. And when we get a disease such as cancer or in our current climate, COVID, right, we get very nervous about like, oh, don't boost the immune system because of the cytokine storm, or don't boost the immune system during chemo or radiotherapy. Like we get very nervous about that. But if we begin to understand Chinese herbs as immune modulators, we can then actually target, right, specific functions of the immune system within our formula writing and maybe remove a little bit of the nervousness that comes along with that. So there are 200 varieties of triterpenes that have been described, and throughout the slideshow you'll see this PMID, and that's the PubMed ID. If you don't use PubMed on a regular basis, it's kind of the storage unit for all published scientific studies. And if you just Google that PMID right there, it'll pull up the study that I'm pulling this information from. This is not all my information. These are bits that I've pulled from about 25 years was my last search of herbal research. So when we name triterpenes, it's not always, it's not super fancy. Ginsenoside is a triterpene of ginseng, but then we also have certain triterpenes that are found across multiple herbs. So lanostane is in Uetza and Lingjur, and damarane is in Datsao, Lingjur, and Jiaogulan. A couple studies outside of this that you could look up. So lupane, oleanane, and ursane have very strong anti-cancer potential, and the study that shows that is linked below. Betulinic acid is a very important compound being studied. It actually induces apoptosis, so that's causing the cell to self-destruct. That's happening in vitro and in vivo, so that's in the lab and in a living research subject. If you're like me, you might have a lot of patients coming in with mushroom supplements, like chaga has been really hot for a while, and betulinic acid is one of the primary triterpenes in chaga. And this can help you in your sourcing as well, because betulinic acid we find in chaga, the source that the mushroom is growing on is actually the primary driver for the level of betulinic acid. So if you're looking at, say, a wild sourced chaga or a lab or cultivated chaga, knowing how that chaga was grown and on what type of wood actually affects its triterpene content. So that should help. That should turn some gears, right, and begin to think about, like, well, am I using mushrooms in my practice, and where am I sourcing them from, and where are they sourcing them from, right? So getting into the science here actually helps you determine if you're using the right herbs. Very cool. So there's a lot of research on anti-cancer activity in breast, colon, lung, and neuroblastoma cell lines as well. When you're doing cancer research, you pull up different cell lines, right? And as we get into more of the research, I'm going to show you where these cell lines, where they're derived from, and what mechanisms are attached to those cell lines. So this is probably the most exciting part. These are beta-glucans. So beta-glucans are polysaccharides. These occur in the walls of mushrooms, oats, and barley. They're complex sugars, so you see these multiple D-glucose rings that are connected. And how they work within our structure, the physiological impact they have, right, is based on their own structure, their molecular weight, and what we call the molecular backbone. These side chains, these connections to the D-glucose rings, form really long side chains, and then they also connect to other proteins. The shape you have right here is what's called a beta-1,3,1,4. This is actually this would be found in oat or barley. For some reason, so the mushrooms are beta-1,3 and 1,6, but the written structure of that turns into this weird 3D long, kind of confusing structure. So I've just found when I'm doing lectures, it's easier to put this beta-1,3,1,4 to explain the overall structure, the chemical structure of what we look at. So let's get into our immune structures, right? Again, this should be review for most of us. So the thymus is where T cells are formed. Our tonsils and adenoids help us identify the invasion. The spleen, so important for us, right? Filters blood, distributes T and B cells. Lymph glands, of course, are responsible for the storage and white blood cell formation. And then it's in the bone marrow, right, that are these that our blood cells are produced. And let me go into that so we get a good, here we go. So this slide, T cells are developed out of hematopoietic stem cells in the bone marrow, right? And then they become what are called lymphoid stem cells. They then transform into lymphoblasts and then differentiate into three types of cells. So T lymphocytes, B lymphocytes, and natural killer cells. Today we'll do mostly T cells, and then we'll do a little bit of natural killer cells at the end. T cells, if you're reading the literature, are sometimes called thymocytes because their final development happens in the thymus, and they help protect our body from infection, but also help us fight cancer. They search the body for cells displaying different antigens, and these can come from infectious organisms, or they might arise from cellular mutations, such as cancer, and these are called neoantigens. And then for us, this is a really interesting conversation because there are multiple factors that disrupt this normal immune function, right? This can include the production of cell surface molecules, cytokines, or growth factors even within tumors that help promote their own progression. So the cancer cells are very selfish in that aspect. I'm always really careful and kind of against trying to find one-to-one correlates between Chinese medicine terms and Western medicine terms. But when you think about the immune environment, you might consider, are there correlations to Wei Qi, to Zhen qi to zheng qi or even to yin qi. So how do we find those correlates? There will probably never be, and there probably shouldn't be, but it helps to begin to have that conversation, on your own. So you might determine or might have new ideas or novel ideas about disease progression from a Western perspective. So we're going to look at a variety of herbs next. When I looked at my mushroom polysaccharides, right, I found that it activated both the innate and the acquired immune system. So there were macrophage triggers, monocytes, neutrophils, natural killer cells, and dendritic cells, which is very cool. Monocytes are adaptive immunity messengers, right? DCs, dendritic cells, are the messengers between the innate and the acquired immune system. And dendritic cells basically attack everything. They're kind of the mercenaries in the body. They go for anything they can't recognize. So let's take a look at individual T cells, right? And I'll give you, in some cases, these will be herbs you've heard of or formulas you've heard of, and in other cases, I'll give you examples of herbs that are things we don't necessarily use in America, but are herbs that could be found and are used often in China. So pro-T cells or CD3 cells help to activate cytotoxic T cells, CD8. Cytotoxic cells are probably the most exciting ones because, again, those are the ones that go directly out to kill cells they don't recognize. These pro-T cells help activate cytotoxic T cells and T helper cells. They're required for overall T cell activation, so therefore they're usually frequent targets of drug therapy research. This is a formula called xiaoaiping. It's actually just one herbal extract, so tongguangtang. This is probably an herb. I didn't check the Chen, so I don't know if it's in there. It's not a common herb for us, but it's if you search the Chinese pharmacopoeia, it's slightly cold and bitter. Is often used in lung disorders, so chronic asthma, bronchitis. It helps with wheezing, removing phlegm. It actually helps rheumatism, swelling, and pain, all kinds of different functions. So they did a clinical trial of this and found there was an increase in CD3 and CD4 T lymphocytes in peripheral blood. There's other Fuzheng therapies that really go after pro-T cells. Obviously, I couldn't give you massive lists of formulas and herbs, but there's another one called Fuzheng Qingjie that's used in cancer therapy, specifically in gastrointestinal cancer during chemo, and that's Huangqi, Nujianse, Lingzhi, Shanyao, Baihua Shishicao, and Xiakuzao. So that's also been effective in stimulating these pro-T cells. Effector cells, these are cells that act locally at sites of infection. They're used to kill other infected cells or to actually help other cells eliminate pathogens. And here's an herb we all know we've used. This is Hualo, right? And that increased the percentage of effector T cells. This included CD4 and CD8, and these help produce interferon gamma. So interferon gamma is a cytokine. It's a messenger for both our innate and adaptive immunity, so it helps us against viral and bacterial infections and even some protozoal infections. It activates macrophages and really induces other cells to help kill the invading pathogen. A little bit more on effector T cells. So Rehmannia glutinosa. So this is Shengdihuan. Sure, I'm happy to spell some of the words. Tell me which ones aren't there, and I'll try to get some of them out there. So Shengdihuan, right, Rehmannia glutinosa. This is a relatively recent study, which is nice. This is a standardized extract, right, of unprepared Rehmannia. And they found that it increased the percentages of central and memory cells and effector memory cells in murine models. And this liposome, you might have seen like liposomal vitamin C. This is like a lipid or a fatty encasement, right? And we use this as a vehicle for administration of nutraceuticals, supplements, herbs. Any kind of supplement can be encased in this liposome. So that's an interesting field of study for us. T helper cells. So these are the big ones. These assist white blood cells in the elimination of pathogens, and again, part of both our acquired and our adaptive immune system. They activate cytotoxic T cells and macrophages and aid the maturation of B cells into plasma and memory cells. So any research that can go towards T helper cells is really important. They help suppress and regulate the immune response by secreting cytokines during the immune response. And what's interesting, we're gonna go through Th1, 2, and 17. They differentiate into various cells, and we're going to see how they can be both a positive factor in the immune system, but also a negative factor. So this is where regulation becomes key. Zhang and his research team use Rotsang. This is Sustanch as a replacement for alum as an adjuvant. So I was told to exclude this in my research because it wasn't technically cancer therapy, but it's such an interesting study to me, regardless of where you sit on the vaccine or anti-vaccine continuum. This idea that we might be able to use plant sources and Chinese herbs in place of metals as an adjuvant is really fascinating to me. So in this study, they weren't really looking for a cancer treatment. They were looking for it as an adjuvant. But what they found was it enhanced proliferation of T and B cells, increased the production of interferon gamma and IL-4 in CD4 T cells, and the expression of interferon gamma in CD8 cells. So that was a really cool study and something I kind of threw in my paper and will go in my dissertation as well. It's outside my parameters, but it's just too cool to ignore. And again, this is a recent study. This is only 2 years ago. Another herb, and actually another yang tonic, right? So Wong and his team studied the polysaccharides of epimedium, so yin-yang hole. This increased CD4 differentiation and increased the immunomodulatory cytokines while inhibiting growth of tumors in Lewis lung carcinoma-bearing mice. That's a lot to say. So again, when you're looking at Chinese herbs and you're looking at cancer research, this Lewis lung carcinoma is kind of a typical cell line that researchers will look to try to find herbs or drug targets for. And looking at Sustanch and then looking at epimedium, we see 2 yang tonics, right, that both help T helper cells. It would be a lifetime of study, but it would be interesting to look at entire categories of herbs and see, do the mechanisms move through all of those various herbs within a category. It's beyond my research, but it could be a really cool field to look at. In the paper I just published in Frontiers in Pharmacology, it started like this, where we grouped herbs by T cells, but then when we went to publish, we actually flipped it into the 8 methods of treatment, like Bufa, tonics, Qingzhi, clearing heat, because we wanted to give a more clear connection to Chinese medicine, not just kind of go completely science and categorize Chinese herbs under their various T cells, the way we're doing here. Also in the T helper cell category, we have the polysaccharides of Gansel. These polysaccharides suppress the growth of tumor cells in C26 tumor. This is a colon cancer cell line, and it also activated CD4 and CD8. We also saw cytokine production with increases in interleukin 2, 6, and 7. So very interesting, and also decrease TNF alpha levels. So there are many herbs that you're already using that are serving some of these functions. So TNF alpha in that last one, in case you, again, it's not clear, that's another cell signaling protein involved in systemic inflammation. So it's usually the acute phase reaction to the inflammatory response, right? It regulates immune systems, it's pyrogenic, so it induces fever, it helps with apoptosis. But in autoimmune disorders or inflammatory bowel disease, TNF alpha actually doesn't turn off, right? So it gets jacked up and then it doesn't get the off signal and then it remains kind of overstimulated. So again, looking at this, even though we're concentrating on cancer and cancer therapy, you could begin to take some of these mechanisms, right, and look at other diseases or other disorders that you treat. So looking at TNF-alpha and thinking about licorice and Gansal, like look at your inflammatory bowel patients, even Alzheimer's, things like that, and you can begin to find another path of research, right, for maybe some of your more difficult or challenging patients. So Th1, this is one of the differentiations of T helper cells. It's responsible for activating and regulating this development of cytotoxic T cells. It also regulates the production of cytokines, interferon gamma, and TNF-alpha, so very important. It secretes or induces the secretion of interleukin-1 beta and IL-6, right, in antigen-presenting macrophages, and this collaboration is what leads to cancer cell death. So that's very exciting to us. The release of these cytokines activates death receptors on the tumor cell surfaces, leading to their destructions. So usually when we're talking Th1, we're looking at these cytokines, interleukin 1, 2, and 12. This one's kind of an oddball. I don't know that many people are using this, but it's kind of cool. The larvae of domestic houseflies. This is used in China for cancer therapy, cancer treatments, but also osteomyelitis, decubital necrosis, and other diseases. So one of the things that I found in looking at the research studies, specifically in mushrooms, but also in other herbs, is the treatment time frames are very short. So here we had oral administration of the larvae for 10 days. And this inhibited this S180 sarcoma. This is another cancer cell line. It enhanced splenocyte proliferation and enhanced natural killer cells and cytotoxic lymphocyte activity from splenocytes. So it promoted these Th1 transcription factors. But 10 days, I mean, that's really, that's incredibly fast to see that kind of reaction. And you can check out that study there. I've got the PMID there. So remembering that splenocytes can be any different type of white blood cell, and that the splenocytes have a lot of different like T and B lymphocytes, dendritic cells, macrophages. Those all can be included in this cell population of splenocytes. So when they say it enhanced splenocytes, we could be looking at a lot of different cell lines. This is another Fujung formula. So again, normally given during cancer treatment, but could be at any time prior or after. So these are all herbs we've seen before, of course: renshen, huangqi, lingzhi, dangui, and gochitsa. This inhibited the proliferation of hepatoma cells and induced apoptosis by promoting the production of Th1 and IL-2. So it's in understanding these mechanisms, you know, that when you're talking to oncologists or other doctors, that you can make them a little less afraid of introducing herbs into a treatment protocol. One of my mentors and a doctor that teaches in our faculty here at Yosan says something really important. He says, Chinese medicine practitioners are the translators of this medicine, right? Your Western colleagues are never going to bother to learn about qi tonics or clearing heat or jingluo or any of these phrases. So the more comfortable we become in this language, right, we can have these conversations with them and alleviate their fears, right, in introducing herbs. You know, and kind of on the side of that, you know, gochitsa, even if an oncologist says like no herbs, you know, we can usually get through dietary restrictions, and mushrooms, goji berries, things like that, they're usually a little less afraid of. So having those honest conversations with them and understanding these mechanisms can kind of help you bust through and actually be able to give your patients herbs during their treatments. Th2, so this is a really interesting T cell, essential in facilitating protective type 2 immune responses, which is the immune response for allergic diseases like asthma. So it produces these cytokines, interleukin 4, 5, and 13. It actually facilitates tissue repair, targets parasites, but again, with overstimulation, contributes to chronic inflammatory diseases. So it can actually make asthma and allergies much worse. It does have anti-tumor effects, but it can actually contribute to tumor growth. So it's a really challenging aspect of the immune system to study. So what we come up with is researchers are often look at the ratio between Th1 and Th2. These factors that Th2 secretes, again, interleukin-4, 10, and tumor necrosis factor beta, these guys can play a suppressive role in the tumor microenvironment, but they can also promote tumor reoccurrence. So you can see where if Th2 kind of goes off the rails, right, either from medication or just a physiological process, the patient can move deeper into their disease process. Transforming growth factor beta, that TGF beta, controls proliferation, cellular differentiation, and other functions in cells. So we want to find regulation here in Th2, and we want to find a balance between Th1 and Th2. So in this study, Wei and his team looked at huangqi, and they did an isolated extract of chunxiang. So this is an interesting study to me, and I put this one in the slideshow because you'll often hear people talk about not using blood movers, right, or even blood tonics in cancer. But here we have, an extract of chunxiang along with huangqi. So they found that this formula enhanced levels of Th1, but reduced the Th2 cytokines. And this was specifically looking at lung cancer patients. So I find that to be very interesting. Often the things that we've heard or become used to from our entry-level school programs don't really bear out when we start to look at what's happening in research. Here's another study, Wang and Chen, patients with esophageal squamous cell carcinoma receiving radiation therapy. So what would we expect from that? We'd expect low white blood cell count. We'd expect pain. We as Chinese medicine practitioners would probably expect some type of yin fire or severe yin deficiency with heat. What these radiation therapies were doing physiologically, they were lowering the expressions of Th1 and the associated cytokines with it. And then they were increasing the expressions of Th2. These are interleukin-4 and 10. So they gave what's called ID injection. This is Banmao, Renshen, Huangqi, and Suja, which is Eleuthero or Siberian ginseng. They gave this during radiotherapy, and this actually inhibited Th2. So we might be able to reverse Th2 predominant status and have better patient outcomes or disease outcomes if we're willing to give herbs during the actual conventional treatment. And of course, this is an injection, and I think there's only 3 states that can do that. So that's a whole other lecture. That's a whole other debate. Th17 also incredibly important. These protect the body against pathogens. Again, they're part of our acquired or adaptive immunity. They mediate the regression of tumors. So here, you may also find that they promote the formation of tumors, and this can happen. Sorry, that should say chronic inflammation, not colonic inflammation. That can happen in chronic inflammation. And we see these in a wide variety of tumors: ovarian, gastric, prostate, renal, and pancreatic cancers. So it's not just in one type of cancer. In this study, researchers had an extract from Baito Wang that, if you remember, clears heat, relieves toxicity, goes to the stomach, large intestine, and is a bitter cold herb. And we find that actually a lot in Chinese medicine research and herbs dealing with cancer therapy. So again, if we wanted to do a huge study just looking at specific categories of herbs, that would be a great target to look at. So in this study, they found that Baito Wang inhibited Th17 cell differentiation, and it reduced the Th1 and Th17 inflammatory responses. So again, if the inflammation has not gotten the turn-off order, right, if it's just in a constant inflammatory state, we can use Bai-To-Wang, and in this case, this was a standardized constituent to pull down and regulate that inflammatory response. Bicolin, so this is a very popular supplement. You've probably seen, if you go to Whole Foods or your local health food store, you'll see this sold as like a nutraceutical. It's an extract of huangqin. The effects are, again, looking to regulate Th17 and T regulatory cells, which we're going to do next. It decreases inflammatory mediators. So in the supplement industry, you'll often see this sold for constant inflammation, joint pain, things like that. There are even nutraceutical companies selling this as basically as a tonic, like take scoop all the time. So they looked at the related cytokines, interleukin 12 and interferon gamma, in ulcerative colitis, and found that to regulate there. It also reduced Th17 cells, interleukin 17 and interleukin 6. So very cool study, and again, the PMID is right below. These are fun cytotoxic T cells. So these are kind of the assassins. They go out and they have the ability to recognize cancer cells and virus cells, and they kill them directly. They don't need to signal anybody else. They don't talk to the rest of the crew. They just say, hey, I don't like that guy. I'm going to take you out. So I think when a lot of us are looking for cancer treatments, this seems like a really good target to go after because it's so direct. This is an older study, but when I was in Chinese medicine school, I heard a lot about Baihua Shishicao, so I wanted to include it because I think this is some of the earlier work on Baihua Shishicao. So Yoshida and his crew looked at a standard extract of the herb, and they found that it enhanced the induction of antigen-specific cytotoxic T lymphocytes, and it stimulated murine spleen cells. So murine, whenever you see that in a study, has to do with a rat study. So these were not done in humans, but it's an older study. But I wouldn't be surprised if it's kind of the root of the information that we hear in our educational system, in Chinese medicine education, about Baihua Shishicao overall effects in cancer therapy. So I thought it was important to include there. This coming back to Xiao Ping, so this is that single extract of Tongguangtang, and here they use it in combination with cisplatin, which is a chemotherapy drug. And again, if you're dealing with oncologists and patients going through chemotherapy, it's nice to be able to pull these studies out and say like, hey, look, here it is, and maybe you can at least get your oncology team to think about adding herbs to the person's protocol. So here Xiao Ping promotes the infiltration and function of these CD8 T cells and actually reduced tumor growth. That's while chemotherapy is happening. An herb that we're all familiar with, again, Gochitsa. He and his team also found similar effects in Gochitsa, but they really looked at the polysaccharides, right? And this study increased CD4 and CD8, reduced immunosuppression, and actually enhanced anti-tumor functions. So all positive results. The other thing that's worth mentioning is in looking at all of these research studies, literally hundreds of studies, you almost never see any side effects. So that's a really positive factor. Here's another one again that we're all used to, Honghua. This increased reduction of cytotoxic CD8 T cells, enhanced dendritic cells, also stimulated spleen T lymphocytes, right, and heightened the expression of antigen-presenting cells. So again, boosting the immune system, allowing the immune system to be more functional in its aspects of fighting cancer. Really important. Almost there. It's a lot of material. So CD4, CD8 cells. These are double positive T cells. These are cells that express both CD4 and CD8 co-receptors. The interesting thing about CD4, CD8 is we look at them in a lot of other diseases, and specifically in HIV, we look at the ratio. The normal ratio is about 1 to 4, so we can look at this CD4, CD8 ratio and kind of have an idea of the prognosis of the disease path and give a better prognosis for the patient. This is a really simple injection again, Shenqi Fuzheng. So this is Cotinopsis and astragalus or Dongshen Huangqi. This also improved chemotherapy outcomes and improved immune function. So we had upregulation of CD3, CD4, this balance and upregulation of CD4, CD8, and of natural killer cells. And the cool thing, the thing that I love, it actually reversed the side effects of traditional cancer therapies like chemo and radiation. So it reduced leukocytopenia, thrombocytopenia, and gastrointestinal toxicity. So very cool study, and makes me want to be able to do injections. So Tregs, or regulatory T cells, these play an important role again in regulating the immune system. So they prevent autoimmunity and moderate inflammation. So depending on where they are, what their ratio is, right, they can actually contribute to disease processes or help regulate disease processes. They play a very important role in the development and progression of cancer, and they help, again, they secrete more cytokines, right? That's often what we're talking about with T cells. And these may reduce the regulatory influences while enhancing anti-tumor immunity. Yes, don't forget that question. I see it in the chat with breast cancer. We're going to talk about that. So regulatory T cells here, Feiyanning. This is a pretty large formula, but again, just about every herb in there is something that you can easily access. Let's look at the study for that. So this Feiyanning decoction was found to reduce Tregs in the spleen, thymus, and in tumors. It downregulates this FOXP3 mRNA, a signaling molecule, and it could be used as an adjuvant to improve chemo and radiotherapy outcomes. And they're even talking about using it as an anti-cancer vaccine. Yep, I'm seeing your questions. We're almost there. We should have time for all of that. So regulatory T cells, again, coming back to a variation of artesunate or artemisia, normally used to treat malaria. This is a tiny bit older study, but it showed that ART, this extract, is capable of inhibiting orthotopic tumor growth in human cervical cancer cells. So that's a big word. That's a big phrase to say. So when we talk about orthotopic, we actually take cells from a human site and put them in say a mouse or another organism to be studied. So we make sure that the environment is exactly the same environment that we're getting in the human environment. And one of my favorites, Ganoderma. So this again, looking at Ganoderma polysaccharides. This inhibits the tumor growth in hepatoma-bearing mice, increase the ratio of T effector cells, and also increased IL-2 secretion. And we're almost there. Memory T cells. So these are cells that have had interaction with specific antigens or cancer, and because of that, they're able to mount a very strong or rapid response to the cancer or the pathogen. And again, coming back to Rehmannia glutinosa, polysaccharide in a liposome in a fat encapsulation. This induced immune memory, increased dendritic cell activation. It strengthened antigen-presenting functions. Again, this is a cool study because it looked at Rehmannia glutinosa as a vaccine adjuvant. So far we've had Sustanch or Rotsong and Shengdi Huang in a liposome encasement to be used as vaccine adjuvants. But the results were the same thing. It actually had an increased anti-tumor and antiviral response. So again, a really important study to look at, in the future of research. And then finally, natural killer cells. These are cytotoxic lymphocytes that behave like cytotoxic T cells. So these don't require antibodies. They don't require MHC to respond to these harmful cells. In research, you'll often see them as CD56. They play a major role in detecting and controlling the early signs of tumors. They produce also interferon gamma, and they activate M1, which are macrophages, and Th1 immune responses, and they can directly increase the cytotoxicity of cancer cells. Long chain, again, Scutellaria often shows up here. This, as we know, clears heat from the body, but it promotes natural killer cells, dendritic cells in T cells, in tumor cells and tumor tissue. And there's a extract of it, woganin. This is a flavonoid-like chemical compound that also induces apoptosis via dendritic cells. So very cool. And goji. Goji LPP40. So this is a standardized extract. It's available commercially. You can definitely get it. It increased the response rate and effectiveness of natural killer cells in advanced stage cancer patients. It inhibits the growth of colon and breast cancer, along with leukemia, liver, and gastric cancer. And it reduces the inflammatory response by limiting the NF-κB pathway, which is a nuclear factor kappa B pathway. That's a inflammatory pathway that's often triggered via stress or via injury, and there are times where that pathway doesn't actually turn off again. So goji and this extract actually helps inhibit the inflammatory pathway, and that's what this study also showed. Hey, we did it. So, I mean, this is a massive information just shoved into, you know, a little bit less than an hour. Obviously, there are still a huge amount of questions to answer. And I've provided references with, I think, almost every slide, so that's really easy to find where these studies came from. For me, trying to understand the scientific mechanisms, right, helps me speak to Western medical doctors. Again, if I talk about chi and channels and all these other things, as you guys know, they're pretty much lost. But if I can provide the translation, right, no matter what I'm thinking in my head, if I'm thinking chi, but I'm talking in, you know, in the language of science, so I'm talking about T cells, you know, I have a better interaction with them. Let's look at some of the questions and see if I can get through those. Let's see. I don't know if Donna's there. Is it best to just kind of scroll through the chat and get them? Okay, so the question from Aviva: are there any herbs or herb formulas that specifically target breast cancer, and how do we choose which herbs to use or not? What should be our thinking? This is a huge question. So in my clinical practice, when I go to China to do my residency, I do work in a lot of different cancer specific clinics. And the one thing that I come away from, especially in outpatient clinics, is pattern differentiation, right? So whether someone comes in with breast cancer and they have spleen qi deficiency, or they come in with breast cancer and they have yin deficiency with empty heat, we can't get away from the pattern. So most of my herbal mentors, what they're doing is they're, you know, kind of using the same formulas that we've all learned, Gui Pi Tong or you know, Romania 6 or Liu Wei Di Wang Wan. But then they're looking at specific herbs, right, that have shown in research to be anti-cancer. And the interesting thing to me, right, is that we can, once we understand the mechanisms of specific herbs, right, we can keep that herb within its category and to make sure that's appropriate for the patient. So we don't want a list of herbs, right, that are like, hey, all these herbs are good for colon cancer. But really, when we look at their properties, like one is a yang tonic, one is a yin tonic, one is clears heat and relieves toxicity. So we want to be careful, right, in our treatment strategies to still go back to pattern differentiation and our Chinese medicine practice. It's not just, hey, here's a big formula with 40 herbs that are all anti-cancer. You do see in the hospital settings where injections are possible, where they're doing these Fuzheng therapies, and they're mostly tonic herbs, because what they're looking to do is modulate, regulate, and improve the overall health of the patient while they're getting chemo and radiotherapy. And there might then be one or two herbs, right, that have some kind of anti-cancer property, whether it's stimulating CD8 cells or stimulating natural killer cells. So for me, the way that I use them in my own practice is I make sure the pattern is clear, and the herbs that I'm choosing, right, they have a scientific basis for being anti-cancer, but they still fit within my pattern. So I hope that answers that question. An easy way to find herbs for breast cancer, right, would be to go on PubMed. So the decoction that I use in my breast cancer patients is Yunjin Danshen, right? There's a really good study. I don't have the PMID for it in here, but if you look up Yunzhi, you'll find this in post-treatment breast cancer patients, increasing survival time and quality of life, utilizing those two herbs. Let's see what else I can find. Yeah, and same thing. Somebody asked about ovarian cancer. So again, looking at this, massive list of herbs. Once you're comfortable with PubMed, look at pattern differentiation. What is the patient who's going through ovarian cancer experiencing? Right? Is it going to be a Guizhi presentation? And then I'm adding, maybe it's Yunzhi, maybe it's some other medicinal mushrooms, right? And how am I going to use that along with pattern differentiation to devise a formula? Peiru Chen asked the last decoction, Fei Yanning. Let me find that for you. That was the decoction you were asking about. Okay. Yeah, and also someone mentioned Dr. Weber. Awesome, great webinars on cancer. Somebody else asked, would you recommend dried herbs or powder herbs for treating patients with cancer? I recommend whatever herbs your patient will take, because that's really the important piece. If they're not comfortable, utilizing raw herbs or powdered herbs, that's really the most important piece of it. I tend to use. I'm really comfortable utilizing patents and then layering single herbs or other extracts on top of that. I feel like if a patent is really well made, if all the herbs are cooked together, I feel confident that the mechanisms are still in place. And then if I can't do that, I'll do an herbal company. Sorry, eLotus. I'll do an herbal company that does the extracts where it comes as a liquid in a vacuum pack. But in most cases, I'm using a patent with, say, a mushroom or another herb as a single herb on top of that. Let's see. References. Oh, so if you look at, somebody asked about references also in the very last slide where my contact info is. The link at the bottom is the article that I just had published in Frontiers. It goes into more depth with the mechanisms. We also divided it into the BAFA, the 8 treatment methods. And then there are, I think, 130 references or so. So you could easily dig into some of those references on there. And hopefully once you go through some of the PMIDs, you'll have more confidence to actually do some searches within PubMed and actually find, specific, if you've got a group of patients with specific diagnosis, you feel confident kind of pulling out those herbs. And you can always email or contact me, and I'm happy to guide you towards other papers that I've come across that might be interesting. Let's see. So how do you address patients who are on 20 medications with liver cirrhosis? Thank you, Linda. Hi, Linda. Team care. You've got to go back to the doctor. And this is part of your skill as a practitioner, because you can't call up an MD and say hey, your guy's on 20 medications and all the side effects are just being enhanced by each one of those medications. But talking to the MD, becoming part of the team for patient care, and making sure that all doctors know which medications are being prescribed, because often when you have someone who's on 20 medications, you find that 4 were prescribed by one person, 4 were prescribed by somebody else, and then 10 were prescribed by somebody else, and they often don't even know, or they don't check, and depending on where they're getting filled, right, there may not be a set of checks and balances to help you get out of that, to make sure there's no side effects, right? Once you can prove side effects, sometimes you have a little more in with the MD and saying hey, she's coming to me for all these side effects and it's really the result of these 3 medications. Is there anything else we can look at? That's kind of the way I approach it, trying to get into team-based care. And then I I guess the last one, Rebecca said, is there any kind of particular mushroom best for boosting the immune system? You know, it's a great question. It's a tough question because as Chinese medicine practitioners, we don't want to just say, hey, everybody in the world should take reishi. But I will kind of say that, hey, everybody in the world should take reishi. You know, what's our patient's constitution? You know, what is their overall quality of health? Where are they in their health process? That helps me determine, you know, what formulas or herbs they should be on. You know, and when COVID hit us, there was a lot of discussion, like everybody wanted to just give Yuping Fengsan, you know, and there's a lot of debate on like, hey, not everybody should take Yuping Fengsan. You know, are you doing pattern differentiation? It's the same problem with mushrooms. Like, not everybody should be drinking, you know, mushroom tea every morning. Not everybody should be doing, you know, 17 mushroom extracts all day long. So it's a sticky one to say, but I would still say that reishi is kind of my go-to, and I'm usually not afraid to say, like, you know, hey, the whole family should take reishi. It's just been my go-to for over 20 years, so I feel confident saying that. And then let's see. So you guys are asking questions about individual types of cancer and herbs or beta glucans. For that, again, it's a massive undertaking to kind of categorize them that way. So your best bet is still going to PubMed and seeing, like, you know, where is the research taking you. There's a book. Oh God, the name has disappeared from my brain. It's called like Medicinal Mushrooms. There's a consumer version that's very thin, and there's a practitioner version that's a little bigger, and that's a great resource. But I'm sorry, the author is escaping my brain right now. And if you can pick up that book, again, it guides you toward that. And of course, Dr. Chen's book, right? Dr. Chen, the Chen and Chen pharmacology book, you know, and in every herbal section, right, there's a link to studies. And even if that was quite a while ago, that can guide you towards newer studies. So that's a great place to look. And I see Donna. How are we doing?
Thank you, Rob, for a great class today, and thank you, everyone, for joining us. We hope you were able to take some information today and apply it towards your own clinical practice. Today's webinar has been recorded and will be available on our TCM Wisdom Tube as well as our YouTube. So if you'd like to watch any parts of it again, you're able to just either log into your eLotus account or visit us on our YouTube channel. That's it for today, everyone. Thank you so much, and we hope to see you at our next webinar. Have a good day, and we hope to see you soon. Bye.
Thank you.
Thank you.